This is Stanford Engineering's The Future of Everything, and I'm your host, Russ Altman. The health of a community doesn't always just depend on access to doctors, nurses, and other healthcare workers. It also depends on the quality of life in that community, the buildings, the parks, the shopping areas, and also the social interactions between people in this community, as well as the public services that are provided. Many other things affect the general health of the population, the ability to cope with change, stress levels, access to quality sleep. Stress, coping, sleep, they all have direct impacts on health, including the ability to exercise, manage your diet, manage your diseases, manage your medications, and follow up when there's health issues. Well, Abby King is a professor of epidemiology, population health, and medicine at Stanford University. She and her colleagues have created a platform called Our Voice that enables community members to document what is going well and what is not going so well in a community by uploading photographs, sound files, and text files. These start a community conversation that allows the community to prioritize what needs to change and then take steps to improve the community. Abby refers to the participants in Our Voice as citizen scientists because they are taking active roles in understanding what can change and then changing it. Abby, your work is focused on improving public health, especially for chronic diseases. And yet recently, you've been using communication technologies to try to accelerate our ability to deliver public health. Tell me how you came to this and what's up.
So thanks, Russ. So I'm a clinical health psychologist by training. I've always been interested in healthy lifestyles and health behaviors. But throughout my training and my years of doing research in those areas, there was a central piece. There were two central pieces that were missing, actually. One has to do with the environment. It's not just about our hopes and dreams and our motivations to be healthy. Our environments have a huge role to play in whether we can easily make the right choices or not. So that was always very important. The other thing that I noted was that we always had our scientific experts involved. Sometimes we had our policy people involved in our research, but there was a key group that was missing, and that were the community members themselves. Who knows their neighborhood better? Who knows their community better than the people living, working, playing, learning in their own communities? So that out of that came Our Voice, which is really focused on making sure that everybody, regardless of their backgrounds, their age, their circumstances, can actually contribute to healthy living and healthy environments around them.
So tell me, so what is Our Voice and how does it do this enabling process for folks who want to get involved?
Our Voice is a participatory action method that has now grown in terms of the evidence base. We have a decade worth of evidence showing that if you can teach people how to go through 4 simple steps, that they can end up getting empowered and actually changing their communities for the better. So it starts with a mobile app. We were talking about technology. This is a very simple mobile app. It's multilingual. It's currently in 13 languages and counting. And the goal of the mobile app is to put it in the hands of residents. And we've done this with people ages 9 to over 95 years old, and show them. Usually takes about 5 minutes for them to learn how to use the app. And they walk around their neighborhoods or their parks or their schools or whatever the issue is. And they do a couple of things. One is they take photos of those things in their neighborhood that either help or hurt their health. Then they tell a story about that. They let us know, why did you take this photo? What is it about what you're looking at that's really affecting your health or well-being? Then those data are pushed up to a secure Stanford server and then shared back with the community members who, in a facilitated process, learn together what were the major barriers and enablers that they have discovered. They share that information. They get consensus about the most important, high priority, but feasible things that could be changed in their local environments. And then they learn how to advocate and activate local decision makers, policy makers, and stakeholders so that they can work together to actually make feasible but important changes.
So that's amazing. And just to unpack it, maybe you can give me an example. So I know that you really are all over the world in the United States and many other countries. What would be, so you said you give this person an app, and so there's a million questions I have about how you get somebody to use an app, because that, there are many, many very rich people in Silicon Valley who have this problem. So that's an amazing thing right there. But let's just for the sake of argument, they have the app and they want to use it. They go walking around their town. How do they decide what to document? And then tell me about the process of how your team then figures out where are the signals that are really strong and what is something that may be affecting that one person, but it doesn't seem to be a community issue. It just seems like a very complicated process. So maybe unpack an example.
Thanks for that question. What we do is what we call by the people citizen science. And let me back up and just tell you about how we conceptualize citizen science. So Stanford and other universities, there's 3 types of citizen science. There's citizen science for the people. This is what Stanford Medical School is known for. It's the biomedical research where people donate their tissue samples, other kinds of things. They fill out questionnaires, but their participation ends at the clinic door.
Right.
The next kind of citizen science is citizen science with the people. Our colleagues in ecology and biology and astronomy, the natural sciences have used this kind of citizen science a lot, where unlike the first type of citizen science, these people learn how to collect standard data in their communities. They're given instructions on how to do that. They capture how many birds in their backyard, or whatever it is.
Birds and bees.
That's it. And trees. So then those data get pushed usually to scientists, other kinds of decision makers, and the citizen, the resident, is out of it.
Right.
We do by the people citizen science, where our goal is to involve residents in as many steps in the scientific continuum as we can, from the early decision making about what the issue is that's really critical that people would like to change. They collect the data, but not only that, they analyze and discuss their data. So we don't tell them what to take pictures of. They are scientists out there taking pictures of what to them is most meaningful. They analyze their own data together. So we have a facilitated process. Our job is to keep them on track, to help them, to help everybody to share. But they're the ones who are doing the heavy lifting in terms of really identifying what issues really are the most important. And we encourage them to look for high priority but feasible things. So not building a bridge over Highway 101 or something, but painting a sidewalk, getting a crosswalk put in front of a school or in front of senior housing, which is something that we have done, with I should say the citizen scientists have done.
Yes. Yes.
And so our job is simply, as a facilitator, bringing together people, community organizations who are usually the ones that are leading these groups. So our public health departments, the food trust, it could be a variety of community organizations that care about the issue that's being looked at. And then those 2 groups meet with the key stakeholders. So for instance, we had a project in North Fair Oaks, and the residents, largely Latinx community. And one of their major issues was trash in their neighborhood. So they were very interested in walking around their neighborhood safely. But what was happening was that the more affluent neighborhoods around them were using North Fair Oaks as a dumping ground for mattresses, for old toilet, things that they didn't want to take to the dump. They would dump it in to the North Fair Oaks neighborhood. So one of the stakeholders that the North Fair Oaks residents wanted to talk to was the trash company, that picks up everything. And they learned that, in fact, all they need to do is dial a specific number, and that company would free of charge come and pick up the old mattresses, whatever else was being dumped into this neighborhood. So it's very solution oriented, it's very pragmatic, but the changes that we aim for as part of this process are meaningful changes that can make it easier for people to walk in their neighborhoods, to buy fresh fruit in their neighborhoods, to feel safe from crime in their neighborhoods. It's a variety of issues.
So it's fascinating because of course you've published widely and for a long time about issues of chronic disease from stress, from sleep, cardiovascular disease, many areas, and this sounds like it's very broad in scope, and it sounds like that's kind of on purpose. That the lack of a safe crosswalk is a health issue because people get hurt if not. The presence of garbage or on the street, actually is a health issue because of the stress it causes. There's probably all kinds of vermin involved with that trash. There's also, it's ruining the environment which might otherwise be pleasant. So do you worry about drawing a line between what is health and what is not health, or does the community naturally make those decisions?
We go wherever the community wants to go. And, Russ, it's hard to think of anything that doesn't in some way, as you're noting, affect health through a well-being continuum, through a mechanism related to stress. So all roads lead to health in many ways, but the goal is to go beyond health and include other kinds of important values. So community empowerment, community connectedness, mental health issues, well-being, play, nature. We're getting into nature now because we have some great colleagues here at Stanford that really study the impacts of nature, not just on health, but on the environment. So this is urban nature in particular. But we have yet to find an issue that really doesn't have a pathway to health, yes. but the pathways also are expanded to include all kinds of other values.
And I have to ask, does your pretty heavy use of technology, does that mean that some people have difficulty participating? I could imagine based both on age and demographics, but also access to good quality cell phones and internet. I know you have a lot of projects in Africa, but also in really all parts of the world. So how about access and equity and those kinds of issues?
So health equity is our middle name. I mean, it's the foundational principle that drives us. And our first project was a decade ago, funded by a tiny little seed grant through Spectrum and through the Office of Community Health. And the focus of that was to develop a simple enough mobile technology that anybody, regardless of how much technology they had ever touched, or their reading level or whatever. So we started with older adults living in very low income communities. Most of them had never touched technology in any form. Computer, few cell phones even back then. So we discovered a couple of things. One, they helped us develop the technology that they could use. So it's very image driven and pictorial driven. It's very, very simple technology. And we have fought our developers to keep it simple, because people always want to add these fancy bells and whistles. And that's not where we are going. We want to keep it simple. So they were able to learn how to do it. And again, we love working with under-resourced communities. That's our goal, is to put technology in the hands of people that typically are left out of the technology scene. And in fact, a number of our participants have told us, oh my goodness, it empowers them just to use the technology. Now they feel like, now I get it, what a smartphone is. And for those groups who don't have that, the projects, the community coordinators and organizational people will loan them one. So they'll buy a few iPads or a few smartphones, and they will loan them out to residents. So residents don't need to own their own technology. But they can use someone else's. So we're doing that, for instance, in Alaska, working with Alaskan natives who are very isolated. You have to get onto a plane to get to their village.
Yes.
So, they're using very basic phones that work quite well.
This is really helping me get a feeling for the project. I can't imagine that there isn't some different perspectives among the participants. And do you try to facilitate the resolution of, I don't know if it reaches the level of conflict, but certainly different perspectives, or do you leave it entirely to the community to figure out how to navigate through areas of disagreement or differences about what should be the priority and things like that? Because that seems like it could be a sticky point.
That's the thing that a lot of community organizations and policy people worry about, because they hear a lot from a few people who are the complainers, who go to the city council meetings, who go to the school board meetings. One of our first international projects was in Israel. And Russ, you're familiar with Israelis as a culture. They are not shy. They will speak up. Yes. And when we were working with their national organization, it was focused on older adults, healthy aging. And that was a major concern they had, is, we don't want to unleash more complaints.
It could become like the internet, where everybody's a troll and everybody's anonymously criticizing each other.
Well, we try to preempt all that by first of all, making sure that community members focus not just on the things that are not working, but on the things that are working. Every community has assets. So it's a very balanced approach. We want people to take photos and talk about what is working. What do you love about your community? What helps your health or your mental health? As well as what are the things that you would like to see changed? And it comes down to good facilitation. Sometimes we facilitate if there's no one who feels comfortable doing that. Most of the time, we train local facilitators to do it. So for instance, our local public health departments are fantastic at facilitating. They do this as part of their job, and a lot of community organizations do as well. They know how to move a group along. We have a quadrant sort of system where people can put everything in a higher, lower priority, and they're not stuck on just one priority. They can come up with 10, so everybody's voice is heard. We have, all of our partners have been worried about the complaint issue and unleashing lots of negativity. But again, with this balanced approach, we haven't seen that.
This is The Future of Everything with Russ Altman. More with Abby King next on SiriusXM Business Radio, channel 132. Welcome back to The Future of Everything. I'm Russ Altman, and I'm speaking with Abby King from Stanford University. In the last segment, Abby described how the Our Voice resource engages individuals that identify ways that a community can improve the physical and mental health of its neighbors through specific actions. In the next part of our conversation, she will describe how the data on Our Voice can be combined with other data sources to make it even more powerful at yielding insights about what must change. She will also describe how wearables, watches, monitors on your phone, may provide useful additional information for a community. Finally, she will talk about how Our Voice can expand to improve the health of many populations, both in the U.S. and around the world. So, Abby, I wanted to ask, you've generated through Our Voice tons of data. You must have many, many pictures, thousands of pictures. I think you have some voice and sound files as well. This is a lot of data, and this is the era of big data. So do you think of it as a big data type project? And are there opportunities for even more bigger data to help in the same mission?
Great question. We are certainly in the era of big data. And what happens, big data is fantastic. And you can learn so much about it at that higher scale level. However, what's missing is what we call the color commentary. What is it really like to be living in a certain zip code, in a certain area, in addition to all the large scale census data and everything else. So one of the exciting things we've been doing is working with some wonderful epidemiology and population health doctoral students who are helping us figure out ways to integrate our micro scale photo and narrative story-based data with big data. So having maps, our goal is to have a worldwide map that combines big data around the world that's important. It could be around health, it could be around safety, it could be around.
And when you say big data, you're referring to kind of health relevant data that a government might collect or a private party, but it's at scale so that you have at least a little bit of data about every area code or every zip code in the country, or maybe every even region in the world. And so that might give you an overview type data that you wouldn't get from the local perspective alone.
That's right.
Okay.
We need both. It's a bottom up plus top down approach.
Gotcha.
Is how we think about it. We want to combine those two things. So the big data really anchors some of the major issues and comparisons between countries, within country, between states, this kind of thing. But it doesn't really get to the community level voice and ideas around what is it about this community that helps. And we have there's one project that we've been working on with our colleagues in Colombia, where they've been combining the bigger data with this more micro scale, meaningful community generated data. And they have found places where the big data is great in many areas, but it misses certain things.
Right.
And that's what this micro scale data can provide.
So in addition to integrating with this macro scale data and then bringing your micro scale data, I think you're also working on things like wearables and like even getting more, and that would be more local data about how the people are doing. Does that fit into the model?
Yeah, it really does. So I'll give you an example. Air quality, so important to health, to well-being, to quality of life. And oftentimes you find in communities, including in the Bay Area, there'll be just a couple of nodes where they're picking up air quality for the whole Bay Area. We know that microclimates are stock in trade here, that you can go a couple of neighborhoods away, and if someone's near a small airport, for instance, we have found that can generate effects on air quality. So why not, as people are walking around their neighborhoods, have them also carry or wear air quality sensors, heart rate sensors, blood pressure sensors, all kinds of things. So we're using the Our Voice platform to have it do double duty in terms of being able to capture these other things as well at a micro scale.
So that's very exciting, but it forces me to wonder, have you run into privacy issues with all this? Because now I'm imagining people saying, wow, this is getting a little bit detailed, not about just my community, but about my life. Or has that been something that hasn't come up?
Well, we're very careful, as you might imagine, here at Stanford University. Privacy and safety of data is huge. And Stanford, I'm proud to say, does everything it can to protect individual privacy. So everything that we collect, it's anonymized and de-identified, because it's really about the environment. If we are going to collect something, physiological data, where we think that, it's something that individuals could affect them,
Right.
we get informed consent. So to make sure that that's covered.
In the last couple of minutes, what's the future look like for Our Voice? How is it doing now? And what are your growth dreams? And where are the boundaries? Where do we say this is where we want to go, and that's as far as we want to go? Or do you imagine a much more organic growth in response to challenges that we probably are not even yet aware of? Like, for example, I'm sure COVID threw a wrench like it did into everything. So what's the future look like, and what's the outlook for Our Voice?
Yeah, COVID was obviously a challenge, but also an opportunity. We've learned a lot about what people have been doing to respond to COVID in their own communities, and the greater importance now of parks, of green spaces, of places people can go safely to be able to relax. But our dream is really a worldwide interactive map in multiple languages that is searchable. So if you wanted to know, okay, what are environments looking like in a variety for older women, for young kids, around schools, what are the issues around schools? For us, that's our golden chalice or whatever. That's where we want to go, and to make it accessible to community members through policymakers.
It also strikes me that although you have a very understandable and laudable focus on under-resourced, underprivileged communities, I know of communities that are not underprivileged or under-resourced, far from it, that might benefit from these technologies. Has that come up? And I'm sure it might create tensions, but it also could be a positive direction, or what do you think?
Absolutely. Yeah, we one of our things that you had mentioned to me earlier, the pop-up parks, happened in Los Altos. And, sure, more affluent communities can certainly benefit.
What is a pop-up park for those who are not familiar?
Yeah, a pop-up park is a temporary park that comes out for during certain times of the year, usually during summer. We see this in the peninsula where they roll out the green carpet, and it's used as a temporary park. They can have all kinds of places to sit, entertainment, age-specific activities, all of this stuff. It's been a wild success in Los Altos, and Los Altos has actually been a model for some of the other peninsula communities. So pop-up parks oftentimes also happen when there's construction or something that closes a street, and the street is ugly and not being used. It's a way to draw people back in.
Thanks to Abby King. That was the future of public health and citizen science. You have been listening to The Future of Everything with Russ Altman on Sirius XM Business Radio Channel 132.